Hi, good morning, good afternoon, and good evening to all the participants of this webinar from various countries all over the globe. I'm Dr. Nandini Gokulchandran, Deputy Director and Head of Medical Services from NeuroGen Brain and Spine Institute, and you have joined the series of webinar that NeuroGen Brain and Spine Institute has been doing for the past couple of months in order to create awareness and improve understanding about the various neurological disorders that are now can be possibly treated with stem cell therapy. So the focus is on stem cell therapy and neurological disorders. Today's topic is focused on children with autism, opening up new possibilities for children with autism using stem cell therapy and neurorehabilitation, and to see how effective stem cell therapy can be for these children. Those who have attended a few of my other webinars, for them, they know what is stem cells, but for those who are new participants, just to run through briefly, quickly about what is stem cell therapy and what does it mean. So revolutionary developments in humankind have changed the way we live our lives. All these different discoveries that you can see, radio, television, electricity, internet, telephone, WhatsApp, the virtual world, all these have changed the way we live our lives. Ataxia, dementia, and head injuries. So these are the disorders that have now are being dealt with stem cell therapy and have various amount of successes. Of all of these, autism seems to be one condition in which stem cell has shown beautiful, amazing output, and that's what we are going to see today. Why is it important to address these disorders? Because just look at the statistics. Autism, 70 million in the world, cerebral palsy, 17 million, intellectual disability or mental retardation, over 7 million, spinal cord injury, 5.5 million, muscular dystrophy, 2 million, stroke, 35 million. The numbers are staggering. And as the number increases, this impacts our life in general much more than what it was doing about 10, 15, 20 years back. So it's important to, one, understand these conditions better and find definitive treatment for individuals so that the individual as well as the family can have a better quality life. So what are stem cells? What stem cells? There's a lot of discussion of stem cells. There is a lot of hype. There's a lot of hope as well. So let us first understand the basic of stem cells. What does it mean? Where do they come from? So stem cells, very simply put, are like stem of a tree. Just like stem of a tree gives rise to branches and gives rise to flowers, fruits, and leaves with proper, fertilizers and water, that is growth factors. Similarly, there are cells in our body which can, from one cell, become many, many cells and give rise to any tissue of our body. All of us, when we were in our mother's womb, we were one cell stage, and then we became a bunch of cells, 4 and 8 and 16 and 32. And at a particular stage, we were what are called as blastocyst. When stem cells are taken from this stage and grown in a dish in a laboratory, it can form a whole child. And that's why these cells known as embryonic stem cells have the most potential, but also have the biggest question mark along with it. As a child grows, these cells are then used to form different parts or organs of our body, eventually forming an adult human being. But even in this adult human being, there are niches or there are pockets of cells in our body, various parts of our body, where these cells are lying dormant and can be recalled for repair. And these are the stem cells that we are going to use and are have no ethical issues surrounding them, known as adult stem cells. So how do these cells work? What do they actually do? These cells, number one, the most important characteristic is one cell can become many, many cells. So one cell can multiply 1,000 times and can give rise to a whole bunch of cells similar to the original. Number two, these cells, when given the appropriate environment, can become different types of cells. They can become liver cells, they can become blood cells, they can become nerve cells, they can become heart cells. So just look at the potential that they have. They can regenerate many, many different parts of our body. What they also do is release a lot of positive chemicals which help the repair process in our body, and that's how their mechanism of action, that's how they work. And important is again the formation of new blood vessels. Any part of the body, when it has to heal, it requires new blood supply, it requires oxygen, it requires a whole lot of chemicals to come there and start repair post process. That's what stem cell initiates. It helps to form new blood vessels which can ultimately help the healing of the different parts of our body. Today we are going to talk about the brain. So what is regenerative medicine? Regenerative medicine is basically using certain tools to help regenerate various parts of the body. Here we are using stem cell as the tool to regenerate the damage in the brain such that the damage can repair and the function of the brain can improve. So the different type of stem cells which I mentioned a short while ago, the first is the embryonic stem cells. It is mired with a lot of controversy because of religious issues, ethical issues that we are killing an embryo to further science. Also because these cells can multiply and form a child in 9 months. That means they multiply very fast and thereby have what is called as teratogenicity or tumor forming capacity, and thereby there is a lot of concern in using these cells for purpose of treatment in human beings. What we have is another source of stem cells, the cord blood stem cells. The cord blood stem cells are generally thrown away in the rubbish. These are cells which a child and mother is connected with, and or the placenta and the cord. And now there's a lot of work going on in how to store these cells and use them in the future. So this is still an evolving science, and use of cord blood stem cells currently pretty much limited to hematopoietic disorders or blood disorders. A lot of work again is happening definitely for autism and cerebral palsy as well. But what we do have in our hand now is the adult stem cells. The adult stem cells are taken from an adult body when a body is completely formed. What you can see here is a bone marrow. The bone marrow is an organ where blood is being formed continuously till we die. That means the stem cells in the blood forming organ, that is bone marrow, are always replicating and are active throughout life. This becomes a very attractive source, a very safe source without any ethical controversies, a source which has been studied for years together for its safety, and thereby becomes a very feasible source of stem cells for treatment of various disorders. So a lot of work is happening on repair of wounds. A lot of work is happening on repair of cartilage in the knee. A lot of work is happening for eye repair, for liver, as well as for brain. A whole lot of body of work to help repair the brain and the spine using adult bone marrow stem cells is being done in many places, including NeuroGen Brain and Spine Institute. So we will learn a little bit more about that today. And so adult stem cells from a person's own body is safe, is ethically has no problem, does not lead to tumorogenicity, and thereby a very attractive tool, not only in India but also in the US. In fact, very recently a law has been passed in Texas where the use of patients' own stem cells to regenerate one's or heal one's own body in chronically ill patients has been passed, and it has been allowed. And that's a big step in the direction of regenerative medicine. So when doctors or even scientists or people in general talk about stem cells as being dangerous, what they are doing is they are combining general embryonic stem cells to adult stem cells, putting them in the same basket and labeling them as dangerous, as if we would put together alcohol and a homemade orange juice and call them as beverages which are dangerous or harmful. So embryonic stem cells would be akin to alcohol, while adult stem cells would be similar to homemade orange juice. And I would leave it to you to decide which one of it is safe and which one has no issues. So at NeuroGen Brain and Spine Institute, we choose to work with adult bone marrow stem cells because they're safe, they're non-tumorogenic, there are no rejection issues, easily obtainable, and there are no ethical issues. The scientific basis for stem cell therapy in the world comes from a whole lot of work which has been done from the late 1990s. In 1990, the first ever award for demonstration of stem cells in bone marrow was awarded to Dr. Thomas. In 2007, the second Nobel Prize was awarded to Sir Martin Evans, and recently in 2012, the third Nobel Prize was given to a pair of scientists who formed what is now known as customized or designer stem cells or induced pluripotent stem cells. A lot of even our textbooks talk about stem cells and potential to treat neurological disorders. In India, our ex-president had emphasized on research on stem cells to be done in India. Our Prime Minister has gone ahead and, in fact, gone and met Professor Yamanaka, the Nobel laureate, who was awarded the Nobel Prize in 2012 for stem cell research, to see how that technology can be brought back to India to treat sickle cell anemia and blood disorders. In fact, there's a lot of support for stem cells from the political fraternity. The Prime Minister has supported stem cells as well for muscular dystrophy. So what are the neurological conditions that can be treated? I've already discussed about this before. What is the scientific basis of the work that we do in NeuroGen? It is nothing. It's not that we have started doing it yesterday. We've been doing it for the last 9 to 10 years with more than 80 publications and about 14 to 17 publications in autism, the first in the world to publish a paper on autism. These are the books that we've written, and we are the first in the world to publish a paper on autism as a proof of concept using autologous mononuclear cells. So what is the old thinking? So far, even now, what we had learned in childhood still remains with us, that once the brain is damaged, once the central nervous system is damaged, it cannot regenerate or is incapable of regenerating. However, way back, about 10 to 12 years back, this dogma started changing, and we do not know that there are niches in the brain which continue to multiply lifelong, and the brain, once damaged, it does have plasticity to regenerate and repair, so that some amount of return of function is possible. So even a person with severe brain injury due to head injury can also recover using the help of cellular therapy. So how is this treatment done? What I'm going to talk to you about is how the treatment is done in NeuroGen Brain and Spine Institute. Our experience in treating children with brain disorders, adults with brain disorders, and especially children with autism, we use patients' own bone marrow taken from the hip bone, separate out the stem cells in the laboratory, and inject it into the spinal fluid on the same day. So one needle in the hip bone, one needle in the spine, These are the steps. So bone marrow is aspirated when the child is sleeping and is comfortable. Stem cells are separated in the laboratory. The bone marrow is a thick blood, red fluid. The cells are centrifuged. No chemicals are mixed with it, and what we get is a whole lot of millions and billions of cells injected into the spinal fluid via a very thin needle. So this is a very simple process, helps us to reach this is the stem cell. You can see the stem cell and what this are counted and injected. So why bone marrow? Now bone marrow is the place where blood is formed constantly. It contains all these different types of stem cells. It contains a whole lot of hematopoietic stem cells. It contains a heterogeneous population of non-blood forming cells. That is the endothelial progenitor cells, the mesenchymal stem cells, adult progenitor cells, very small embryonic-like stem cells. Each one of this has different action, and thereby a cocktail of cells. There is differing action which work together, complement each other, and bring about the best results. And that's why the bone marrow. But bone marrow is ethically acceptable. It is from the patient's own body, hence 100% safe. No long-term tumorigenicity. That's most important. Why into the spinal fluid? Now, a lot of patients ask us and are afraid that why are we injecting the cells into the spinal fluid? You have to understand there are three ways that the cells can reach the brain. The most simple way and possibly the most safe way is injecting intravenously. When you inject the cells intravenously, the cells, just imagine the amount of where all it has to travel. It travels all from your veins to it has to go travels the liver, the lungs, the heart, and then reaches the brain. So suppose we're injecting 1,000 cells, how many will reach the brain? We do not know. How many cross the blood-brain barrier? We do not know. The other option, the other end, is injecting directly into the brain. That is known as stereotactic, and that could be the most efficient way of reaching into the brain, however the most risky. So on one end you have a simple way but least effective. On other end you have an effective way but very risky. So what we have found is a middle ground. What we have found is a way to get into the brain without damaging it any further, and that's why we inject the cells into the spinal fluid after the spinal cord has ended. So we do not touch or damage the spinal cord. We merely transplant the cells into the spinal fluid. This fluid, which goes all around the spine and brain, takes the cells to the area where it's damaged. It is known as the homing instinct. So the cells know where to go. They home on to the site of injury. A lot of scientific evidence has been generated which shows that cells have a way to know where the inflammation is, where the damage is, and thereby get attracted. What in addition is done to help the cells reach the brain or the site of injury is rehabilitation. Exercise has been shown to mobilize the stem cells in the brain, help the cells reach where they are required, and thereby rehabilitation done in a holistic way also helps guide the cells to the right place. Hence, regeneration along with rehabilitation is the key to get the best results. So what is autism? Parents of children with autism who are the audience do not need this information, but it's good to know what you are dealing with. So it's basically a combination of three factors: poor social impairment, interaction, impaired communication, and restricted repetitive behavior and restricted interest. All these together finally leads to many problems like inappropriate training with ties, hyperactivity, inability to relate to others. Let us see hyperactivity. Child is running around without any purpose. You will see naughty children who are running, but that's all right. Are curious, it's all right. But children with autism run around without any purpose. They do not have any goal or intention in mind. Poor eye contact. They cannot look at you when you are talking to them. They are not interested in what you're doing because they are self-involved, and hence they cannot relate to you. Even if they can hear you, they cannot understand what you are saying. Repetitive behavior. Children like to do the same thing again and again and again, thereby impairing their ability to do constructive activity. So repetitive behavior again is a constraint in going ahead in learning. Sensory issues. What do sensory issue mean? Sensory issue means inability to respond to external stimulus appropriately. So we know that somebody touches us, how do we respond to them? What does that touch mean? Children with autism either find touch to be very do not like it or like it too much. So either they are hypersensitive or they are hypersensitive. So for every sensation, children will have different responses. Aggressive behavior, because the child is unable to communicate, is unable to tell what he or she is feeling, and that's why responds in an aggressive manner. And so aggressive behavior is one of the expressions of autism. Self-injurious behavior, this is another problem many of children have, that is in frustration they would bite themselves or hit themselves. Inappropriate attachment towards object, they like a particular inanimate object and would not want to separate from it, and that leads to more problems. So these were the symptoms, and let's look at the numbers. These are broad statistics, and but now we know that the numbers are increasing. So in India, 40 cases per 10,000. In the Gulf, it's an approximate of 15 in 10,000. USA 66 per 10,000. There's a prevalence, incidence 94 per 10,000, and these cases are increasing. As per the CDC, in 2008, it is 1 in 59. So the numbers are increasing exponentially. Just look at the autism prevalence, which is increasing. So it is increasing at an alarming rate. So why did my child develop autism is one of the questions that parents ask, and they keep asking. We do not know the exact reason. There are many, many factors which have been put forth, various hypotheses. I'm just going to run through them. This may or may not be relevant to your child, but it could be one or many coming together. So genetics, there could be a genetic background, and there would definitely be an environmental factor which pushes this genetic to manifest. Not all children will have genetic background. Some also would have mainly environmental factors, but generally it's an overlapping causes to overlap. So genetic, there are many genes which are now proposed to be associated with autism, may not be the cause of autism, but associated with autism. And we do see sisters and brothers having triplets having autism, and that's by the strength for the hypothesis that autism could be genetic. Not only autism, but many other neurodevelopmental disorders as well as neuropsychiatric disorders are known to be genetic in origin. Environmental factors, prenatal, antenatal causes play a major role. Intestinal dysfunction, more than the cause of the autism, it could aggravate the autism. Exposure to toxic chemicals, generally it is seen that when the child is in the mother's womb and there is a prenatal exposure, there it seems to be a more has more strength for causation rather than later in life. Use of mobile phones is still controversial whether that leads to autism. So prenatal, antenatal causes very important and preventable to a large extent. Infection in the mother being anemic, nutritionally devoid, diabetes, depression, medications during pregnancy, age of the father being more prematurity and birth complications. These are many of the factors which, if we look at it very deeply, we do find these causes which can cause autism. Older the father, more the risk of developing autism. So a lot of work has happened, and they found 3.5 times more risk. Gastrointestinal dysfunction. There is mood behavioral changes, impaired cognition, poor brain development if a child suffers from gastrointestinal problems, and that's true for any child. Electromagnetic field, mobiles, maybe, we do not know for sure. Heavy metal association has been seen, but much more when the child has been exposed before birth or in early childhood. Lead poisoning, mercury poisoning, aluminium poisoning. Vaccines is a big controversial area, but as medical doctors, we feel that vaccines for most important infectious diseases should be given. They should not be withheld from the child, because a child dying of meningitis due to measles is much more tragic than a child who has symptoms of autism. So the theory that MMR vaccine causes autism has been refuted. So whatever may be the cause, let us look at what actually happens in autism. What is the pathophysiology? There have been various theories: inflammation, imbalance in the neurotransmitters, hormonal imbalance, immune dysregulation, environmental stresses. But what actually finally happens in the brain? So far, we did not have a way to understand what was happening in the brain. MRI of the brain would be broadly normal. It would tell us that structurally everything is all right, broadly, when the radiologist reports that MRI is normal. So we went a step ahead and we looked at the metabolism of the brain. We looked at functionally, let us see how are these areas working, and we found a marked difference in the development of a child's brain who has autism versus the development of a child's brain who is neurotypical. Let us see what that is. So what you see here is a PET scan of the brain, and what you can see here is a brain scan seen from inside out, the side view. This is the front of the brain, the top and the back. This is the deeper part of the brain, and this is the small brain of the cerebellum. The blue part here is the affected part, or the part which is functioning lesser than normal. The green is normal, and the red and yellow are hypermetabolic areas, areas which are looking to be functioning too much. So this is the typical brain of a child with autism. Now, when we look at the different areas, which I will be showing you, different areas have different functions. So we will try and correlate them with the functionally affected brain and the clinical features. So what behaviorally, you know, all these problems. Developmentally, there is a problem with understanding, learning, comprehension, speech. Cognition is affected. Psychologically, sensitivity towards others is. So neurobiology, what do we see here? Let's look at the brain. This is a brain of a 1-year-old healthy child, or a healthy brain of a 1-year-old child. You can see everything is green here. Okay, you can see that the brain is properly developed as opposed to a child with autism. Now, this you can see a brain seen from the front. This blue area here is known as the thalamus. Thalamus is the part where the right brain and the left brain communicate with each other. So it is important for sensory information processing, alertness, acts as a relay center for motor and sensory cerebral cortex. So thalamus is affected most of the time. You can also see that this area of the brain next to the thalamus is the basal ganglia, control of voluntary movement, for learning, for routine behavior, for cognition and emotions Again, front anterior cingulate cortex here for learning, memory, as well as emotional processing. Here you can see this area of the brain blue. This is known as the mesial temporal. This is the area known as hippocampus and amygdala, where memory, cognition, retaining of memory, learning, emotional expression, and social interaction reside. So it is all a circuit. Now here you can see one of the most typical features that we find in autism. This area, completely blue, non-functioning or very low functioning, is a cerebellum. It is important for articulation. More than just speech, articulation, eye contact, tone of the body, coordination, and balance. So all these things, it's like a traffic police on a crossroad. And when the traffic police is not there, you know what happens. There is a lot of chaos, and that's what happens if the cerebellum is functioning lesser. Frontal cortex is red. Red means it is too active, and that's why the frontal cortex, which is responsible for problem solving, for emotional control, as well as for language and judgment, is overshadowed, because too much is also not good. So too little and too much will give you an imbalance, and that's why all the areas of the brain have to be functioning appropriately. Let's look at a few examples of how the scans or the brain improves. This is before the treatment. You can see the thalamus is not properly functioning, so is the mesial temporal is less functioning, and the cerebellum is completely blue. This is before the treatment. This is after the treatment. You can see the difference. The thalamus has started functioning more. The green is good. Mesial temporal is also started functioning better, and the cerebellum has also started functioning. So this is 6 months after the stem cell therapy. This is before the treatment, 6 months later. Similarly, cerebellum before, after. Again, you can see thalamus before and after, before and after. Cerebellum before and after. You can see frontal cortex before, after, going down. So this is the changes that we are seeing. This is the brain MRI. We are also looking at whether there we can find a change in the MRI. Maybe in one of the later webinars, I will talk about brain imaging in much more detail. So let's go to the results now. The PET scan, what we have studied in great detail, how the brain differs, has been published in the World Journal of Nuclear Medicine. For the first time, we have shown how the brain functioning is different. What we see is very simple here. You can see that this blue is a brain of a child developing normally, or a neurotypical child. You can see that between the age of 2 to 15, the brain metabolism or functioning is increasing. Up till 10, it increases fast, and then though it is increasing, it slows down. As opposed to that, in a child with autism, you can see that at the age of 2.5 years, the brain metabolism is high. It is more than normal. That's why many parents tell us till the age of 1.5, 2, my child was doing well. But after 2.5, the child's functioning is going down. You can see just the opposing, it just goes down. So what do we need to do? We need to push this graph up. As we push this graph up, we can see that the child will start to regain whatever the child has lost, or gain what he has never gained. So slowly going towards a neurotypical or towards mainstreaming, and that is the goal or aim of any treatment, including stem cell therapy. So we do a lot of things for our children. We do medications to control the hyperactivity, occupational therapy, speech therapy, psychological intervention, special education, physiotherapy, nutrition and diet. All of these are very important. Definitely they are the mainstay of the treatment for autism, but are we doing enough? What more can we do? Whatever we are doing here so far is from outside. What we need to do is improve the brain functioning or the balance in the brain from inside, and that's where stem cell therapy comes as a ray of hope to address that lacunae in the whole treatment process or protocol. So let us look at what are the results in NeuroGen. We have treated over 1,200 patients with autism, and this is a broad data of 700 patients with about a 90% success rate. You can see that not all children improve completely. There is in 25% children mild improvement, a few of the symptoms improve, in moderate about 30%, and significant changes in the cars, as well as changes in the child's performance, changes in the quality of life drastically is seen in about 30% patients. What are we seeing here? What we generally see is hyperactivity reduces, child becomes more compliant to therapies, is able to sit in one place, eye contact improves, attention concentration improves, and the child is much more open to learning, and thereby social interaction, cognition, communication improves, behaviors can be changed. Behaviors do not change overnight. Once comprehension and understanding improves, then you can use that to change the behaviors. That is very important for parents to understand. So this is data which we would be publishing shortly. What we find is that, of course, males more than females, and the symptoms that improve, we have discussed this. In objective scores also, we find in CARS and in ISA more than 90% children do show a change. But let's look at age-wise analysis. That's what parents ask me. Did we come late? How early should we come? So we do find that earlier the child is intervened on, better the results, definitely. Between 0 to 5, that we would say between 2 to 5 years, about 95 to 98% improvement seen in chances of improvement in about 6 months. So success is more in children less than 5 years. Between 5 to 10 years, it drops a few percentage. However, the results are as good. But once the child is above 10, because of various reasons, which not only pertaining to the brain but also to hormonal changes in the child's body, because there are additional comorbid problems which keep on happening. That's why the success drops a little bit to about 90%. So out of 100 children and in the age of 10 to 15, if we treat, we see changes in about 90% of children. 10% children may not show any improvement at all. Above 15, about 90% of the children show improvement. Males or females, whether it is a male or a female, the response is the same. So the understanding in many parents is that female children with autism are much more resistant to change or improvement is not correct. Stem cell therapy works equally in both genders. Uh, in mild, moderate, severe, we do see that children with mild show improvement, good improvement, but there are several changes, hence may not always be picked up. Moderate also improved to over 94%, and severe, we have only one child in this category, so 100% result. Time since diagnosis, the earlier you treat, better the results. So if you treat within a year of the diagnosis, the results or the improvement possibility is 100%. Less than 5 years, 94 to 98%. More than 5 years, again, because the child is growing, chronicity, parents have been doing a lot of things, they're tired, and hence compliance is less. And so the possibility of success drops a little bit, but never before below 90. PET scan, which I had showed you before the treatment, you can see a whole lot of dark blue here is becoming lesser. The brain, which is damaged, is improving in function. You can see here damage reduce. This is over a period of 1.5 years. You can see the cerebellum improving second time, third time. Also, you can see that the red, the hypermetabolism, which went up a little in the second, but became much lesser after the second treatment. Again, you can see over a period of time, cerebellum, second time, third time, you can see progressive improvement in this child's brain metabolism after the first slight increase in hypermetabolism, then gone down. So first time ever in the history of autism, a publication which came in the year 2013 was from NeuroGen Brain and Spine Institute, where we showed a proof of concept study on how bone marrow derived stem cells from the patient's own body can benefit the patient. After that, the second immediately came from China, the third from the US, and the later ones from the US. NeuroGen Brain and Spine has published more than 14 articles on autism. Let us see how it affects children. Finally, that's what parents want to know. Whatever may be the academic data, let us look at how it affects children. So let us see a few examples. This is a 2-year-old child. I'm starting from the youngest, who came to us very freshly diagnosed, had no, would not sit in one place, would be running around here and there without any logic, would not look at you, had no eye contact, could not follow commands at all. After the stem cell treatment, within a week, we did see that he started following commands. He is looking at the camera. So eye contact has improved. Attention concentration slowly, gradually improved over a period of 6 months to 11 months. This non-verbal child started verbalizing, answering questions, started saying rhymes, sitting in the school, and he is going to a regular school now. And that's the kind of improvement that he has seen because we treated him when he was 2 years old. So he's more aware about the surroundings. His logic is better. He can correlate factors. He can sit in one place and answer questions. You can see his eye contact is much better. And he can speak a few words as well as recite poetries. Just counting numbers now. When you look at him, you don't feel like he's a child with autism, and that's how far he has come. So this is what you can achieve with a 2-year-old child. This is again a 5-year-old child who didn't have any, who had very limited cognition, was very hyperactive, would jump and not sit in one place. After the treatment, he's able to sit, he's able to write, and able to follow commands. This happened in 3 to 6 months. Another child who was about 5 to 6 years old, earlier had no functional play, could not understand, would not respond to the therapist, would not sit in one place. Now sits in one place, matches shapes, follows commands better than before, and has shown an inclination to learn. That's most important. The ability to learn. He doesn't close his ears. His hypersensitivity to a sound or auditory hypersensitivity has reduced. His attention span has improved. He's able to sit in one place and do activities much more. And the resistance to do therapy or activity is much later. Eye contact has improved, as you can see. So you can see the mother also extremely happy because he's responding. Behavior of tapping objects is reduced. So a lot of sensory and stimming behavior has gone down, and productivity in activities improved. Mouthing objects has reduced. Earlier he would put everything in his mouth. Now mouthing objects and coordination has improved, and he started to learn swimming. So this is how you can see the child's improvement in 6 months. This is a very cute girl from Australia who was very cranky, would not sit in one place, had gravitational insecurities, would not, respond, would not interact with her brother. All that has changed now. She's a good girl, as the parents say. She is responding and learning faster. Activities outside, she's doing much better, and being generally a very good, obedient girl at home. A 6-year-old child, he can now follow commands more consistently. Earlier, he could not do that. Social interaction is much better. Uh, Cognition has improved. He can now sort colors. Earlier, he would not sit in one place. Attention concentration, attention span is improved. So when all this happens, you can teach the child much better. Hyperactivity is much less. This is a child who had not only hyperactive, but also had a whole lot of meltdowns, had severe problems, completely non-verbal. And now her eye contact has improved, her frustration level has gone down. She's able to complete her activities, she's able to focus on activities much more. So meltdown has reduced. She's starting to communicate using sign language. She started to vocalize a few words like mummy or mama, and it's responding to diligent therapy. Sensory issues have gone down, and she follows instruction much more consistently. There is a progress in her that the mother sees month by month, and you can see that earlier she was absolutely non-compliant, and now after the treatment over a period of 6 months, a year, her compliance in various activity has improved. So what we find is with stem cell therapy, the rehabilitation becomes much more easier, much more possible. The therapies become effective. Therapists are able to work with the child better. And not only our own therapists, but therapists from various countries have told us that now the children who are working with whom they were working earlier, now they're able to gain much more. Another child from Kenya who had a lot of repetitive behavior, you can see earlier, is now sitting in one place and able to do tasks, finish it much more. consistently. The same task where there was no interest is much more is much better, follows commands much better in every way, is responsive to the therapist as well as the parents. Earlier was easily distractible, now is more focused. Social play, coordination, ability to do activities and finish it is much better. A 12-year-old boy, where he was absolutely, he was unable to sit and match anything before the treatment. You can see that his repetitive behavior has not only decreased, but he's able to match and do things. I'm sorry, I've already showed this to you. A 13-year-old boy from India is whom we have followed up for now. So when he came to us, he was 11 years old. Now he's 18 years old. So about 7 to 8 years followed up earlier. He was extremely hyperactive, had self-injurious behavior. At that time, he had barely finished his, was not even able to finish his 5th grade. Now he has finished his 12th grade, able to train deaf and dumb children, responding or is able to deal better with his father, with whom he did not have a good relation, finished his 10th grade as well as 12th grade, helps in household activities, goes to a shop, buys the grocery items which the mother has told him. This is a list that he's giving. He is able to pick up grocery items, give it for packing, take the money back. That's most important. And in front of the camera, just on instructions, he made noodles and of course ate it too. So that's the kind of growth this boy has seen. This is a beautiful example from this child from Kenya, Victor, and very victorious now. He came to us when he was 12 to 13 years old. You can see extremely hyperactive, aggressive, unmanageable for 12 to 13 years. Parents could not send him to a special school also because of his non-compliance. After the stem cell treatment, over a period of 6 months, this child was able to sit better, able to do activities, much more compliant. Earlier, he used to run out from home, eat like half a kg of salt, mouth anything that been given, would open the door and run away. In general, very difficult to manage. Now this child is now going to a special school, able to sit in one place, do fine motor reading activities, is cycling as well as swimming. Social interaction is much better. Not only that, after 13 years, he started vocalizing. That's the most important thing after 13 years. A 11-year-old girl from India was very, very difficult to manage. Would sit inside the home in the room and eat alone because she could not sit with other people and eat. Now she is independent. She can finish her tasks. She can eat with everybody else. So ability to integrate into the mainstream community is possible. Parents can take her outside. Her meltdowns or aggressive episodes are much less. She can be managed much better, though she is still non-verbal, but possibility or ability to be managed is much better. Again, this is a remarkable child whose father himself is a doctor, a nuclear medicine expert from the US, who has shown a beautiful improvement after the stem cell therapy. His imagination, his comprehension, his language, his eye contact. He's gone from a special school to a regular school. His interaction has improved. He is now able to pick up languages. He talks in his class. He can speak Spanish apart from English. So that's the way this child has grown from a special school now into a regular curriculum and excelling in it. So these are a few examples. Now many parents ask us, you're all telling us good stories, what about complications? So the major complications, if at all we have seen, we have actually never seen, that is because we are using the patient's own stem cells. We do not see any neurological deterioration which is irreversible after the stem cell treatment. The procedure is simple. Procedure-related complications such as headache, nausea, vomiting are limited or can happen for a few days and are self-limiting. On those children or individuals who have a history of epilepsy or seizures or whose EEG is abnormal, there is a 3% chance that the child or individual may have a transient increase in the seizure after the treatment in the first 3 months. This is preventable and can be modulated or can be minimized using a proper anti-epileptic cover. So over a period of 7 to 8 years, 9 years, we have seen that using patients' own bone marrow or derived stem cell done in a supervised environment in a proper laboratory, which is GMP certified by experts, can be safe and effective option for neurodevelopmental disorders, especially like autism. This is NeuroGen Brain and Spine Institute in Mumbai, India, where this treatment is done. We have treated over 6,000 to 500 patients from over 60 countries. We have a state-of-art laboratory and operation theater where a team of doctors do the treatment. This is our staying accommodation facilities in-house with a comprehensive rehabilitation under one roof with different clinicians as well as therapists coming together to treat a child or individual. So stem cell therapy along with neurorehabilitation is a teamwork where the stem cell are the seeds and the rehabilitation is the fertilizer or water, and hence to be done together. Physiotherapy, occupational therapy, special education, speech therapy, autism child development center where we do cognitive rehabilitation or ABA, aquatic therapy, sensory integration room, spinal cord injury, walking track. A whole lot of books written for professionals as well as parents. The soft copy is available on the internet. This is our core team, Dr. Alok Sharma, the director and neurosurgeon. The vision behind this whole concept. This is myself, Dr. Nandini. I'm the Deputy Director and Head of Medical Services, working with Dr. Sharma for the last 9 years. Dr. Jacob, who is the head of neurorehabilitation with the experience of more than 50 years behind him. Dr. Prerna Bade, again Deputy Director and Head of Regenerative Laboratory and a stem cell expert herself. Dr. Himangi Sani, the Deputy Director, Head of Research and Development, under whose guidance 80 plus publications have been published from NeuroGen Brain and Spine Institute. These are our accreditation both for the laboratory and for the hospital. These are our certificates of accreditation and awards for best medical practice, national and international awards from the European Medical Association, as well as from the inspirational company from the US, European awards, national awards at the national level for international excellence for service to disabilities, other awards from the state. This is an award from the Chief Minister of our state.
Today, with the executive order I am about to sign, we will bring change in so many scientists, researchers, doctors, and innovators, patients, loved ones that hope for and fought for this past 8 years. Expand on federal funding for promising embryonic stem cell research. No finish line in the work of science. The race is always race. The urgent work of giving substance to hope and answering those many bedside prayers. Seeking a day when words like terminal, curable are potentially retired from our vocabulary.
So ending with this inspirational speech by ex-President Obama, where he lifted the ban on stem cell research in 2001. What US lost in terms of 80 years after, so in 2008, from 2001 to 2008, federal funding for stem cell research was stopped by ex-President Bush, which was reverted by President Obama. So in that 8 years, the world took over. So the Southeast Asian countries took over, looking at exploring options which are more ethical and do not have long-term complication, and that is adult stem cells. And that's where NeuroGen has taken over, and the experience that we have is unmatched in the world. Please free to contact me on drnandini76@gmail.com. I'm available for Skype on the following address, and I would be happy to answer any questions. Questions. Okay. So, answer the question: can umbilical cord blood stem cell be used? Um, from Mr. My Fakro, who has left, but I'm going to answer this question. Umbilical cord blood stem cell is a very good potential source of stem cells. The use for various disorders is still being understood. It's a very good source for blood disorders like sickle cell anemia and thalassemia, where the donor matched stem cells can be produced or can be found. In case of neurological disorders for autism and cerebral palsy, a lot of work is going on. However, these stem cells currently can be injected only intravenously. They are not recommended to be injected into the spinal fluid to reach the brain. Why stem cell therapy is so expensive? It should be very low cost. A whole lot of research is still happening. A lot of research is happening, and it is a regenerative medicine. You must understand that regeneration is a difficult process, and it's not going to happen overnight. So the work which has gone behind has led to this therapy being evolved. It has to be done by experts. It has to be done in a very with a specific laboratory where chances of infection are zero. So all these things put together, the science of regenerative medicine, and also because it is done by a few people and the know-how is very limited, it is still evolving and thereby expensive. But if you look at other conditions or other surgeries, for example, heart transplant, heart bypass, even that is expensive. Organ transplant is very expensive, and stem cell therapy is a kind of a organ transplant and much more evolved. So yes, at present it is expensive. With time, it will become less expensive. Yes. Hello, ma'am. My question is: I have two children, which one is 10 years old, second is 5 years old. Both of them have autism, and my bigger boy is 95% abnormal. So my question is: can stem cell be effective on them so they can live at a normal child? What is the percentage of stem cell therapy be effective on them? Yeah, we can definitely treat both the children. The children will need to evaluate them, and definitely they can, depending on what their condition is now, we can help in the next few years for them to live an independent life. So please feel free to send us the details of these children. Why stem cell therapy didn't get approval from FDA? You need to understand what type of stem cell therapy that we are talking about. There are different kinds of stem cells, and recently, as I said, in fact, in the US also, use of patients' own stem cells in certain states has gone away from the FDA purview. FDA is Food and Drug Administration, and stem cell is not a drug, and that's why there is a lot of confusion whether it should come under the drug authorities or not, and that's where we are stuck. But use of patients' own stem cells is slowly being removed from the FDA's purview, and so FDA, in fact, approval is not required in autologous stem cells. What is the minor side effect of intrathecal implantation? How many injections is expected to be done in order to see the behavior change? Is the treatment same for both adults and children? The minor side effect after intrathecal transplantation could be headache, nausea, vomiting, known as spinal headache, which lasts for maximum of 3 to 4 days and is self-limiting. How many injections is to be expected in order to see the change? It will depend on the amount of the problem and how much At NeuroGen Brain and Spine Institute, we have a 1 week treatment. In 1 week, we do treatment for once, and then we would like to see the improvement in the 6 months that we would like to follow up. Change in understanding and comprehension will lead to behavior change over a period of 6 months to a year. The broad process for both adults and children is the same, but depends on the disorder rather than the age. Why stem cell therapy for autism is not available in Calcutta, India? Uh, That's something you should ask the Calcutta doctors, I think. Right now, it is available in India, in Mumbai. Hopefully, soon it will be available in Calcutta. As compared to natural medication, do you think stem cell therapy play more effective in balancing the neurotransmitters such as serotonin and dopamine? The medications would help in dopamine and for dopamine, like Syndopa does help in trying to get a balance. But then after some time, its effectiveness goes down. Um, Stem cells will do much more than just balancing the neurotransmitter. It helps also repair or improve the functioning of the brain cells. So it is not just for the neurotransmitter, but for overall improvement. I see the improvement rate is very high. Will the change of individual show consistently stable? Yes, whatever improvement happens, it remains throughout life. So yes, it is consistent. The improvement is consistent. If there are any more questions, I would be happy to answer. I did, I did answer, no? Can an umbilical cord stem cell be used? What is the safest type of stem cells to be used? We feel the safest stem cells are the adult stem cells taken from the patient's own body. There are no rejection issues, no immunotherapy or no chemotherapy is required. There are no long-term side effects, no tumor formation. Hence, the most safest is the adult stem cells. Nakaiba Ahmad Hafizi. Please do ask your questions. Does the individual still have to take any medicine after they did the stem cell therapy? Not many medications. If the patient is taking some medicine before the treatment, we would like to continue that for at least 3 to 6 months because we don't want to change many variables. But for the stem cell per se, there are no major medications required. Any relapse possibility? Are we talking about autism? In autism, no, unless the child, the only time that we see that there can be not a relapse, but sometimes a reversal is when there is high grade fever, which would affect the brain adversely. Otherwise, no, there is no relapse after the treatment. But there would be ups and downs in the behaviors of a child. That is not called a relapse. And there is no reversal, no.
We've messaged asking for any other questions you can also ask.
मेरा नहीं जा रहा है नहीं, it's coming. My son finished his medicine. I have to still carry on. What medicine is he taking? You need to contact your doctor who is giving this medicine, but if you could tell me what medicine he's taking. Autism associated with high mercury in the brain. How does stem cell therapy help? See, these are associations. Okay, as if you had joined earlier, I did mention that heavy metals do affect the brain, but that is when the brain is developing at that point. So that is when the child is in the womb. Heavy metals later, though people do feel that it continues to damage the brain, or we don't think. Uh, uh, ask for the name of the patient. No?
Yeah.
So, or ask them to send us an email. So, heavy metal, the stem cells will not remove the heavy metals, but irrespective of the heavy metals, that because our children who have had high aluminum and all, brain development, which is damaged, or brain functioning, which is damaged, is recovered using stem cells. So heavy metals does not affect the stem cell as such. We do not really remove or chelation or anything. Autism is associated with the methylation. How does stem cell therapy help? See, these are all associations. These are all theories which affect, or which, so as I said in the beginning, inflammation, antioxidation, then free radicals, immune issues, immune dysfunction. All these are theories, but finally, what happens is that the brain function is affected. So you have to understand that the brain functioning is what needs to improve. Even if you correct the methylation or you correct the genetic cause, the brain function may still remain low. So that's why stem cell improves the blood supply in the brain, improves oxygenation in the brain, improves the neuroregenerative chemicals which will help improve the brain function. So whether it is heavy metal related, whether it is because of oxygen toxicity, finally the problem is at the cell level there is a damage. And that damage is counteracted or improved by the chemicals or regenerative chemicals that the stem cells are releasing. So, Mr. Nakeba Ahmed, please contact the medical officer or the case manager, and they will help to let you know whether medication needs to be continued or not. Usmilinga, please.
Navigal is
Hmm.
super there.
Hmm. We have,
We have 2 minutes.
yeah. I think questions are still sending questions. Most welcome, Mr. Singh. I hope it helped understand. So please do again go, we will send you a link of the webinar and go through the presentation again for queries. I have addressed most of these questions.
Sure.
Like,
Please feel free to send me questions on drnandini76@gmail.com. I would be happy to answer them. Okay. Have a good day. Thank you.